My name is Lihme, and this is a video abstract of our study entitled Comparison of Clinical Blood Pressure Measurements to Measurements According to Guidelines in Women Admitted to the Maternity Ward for Hypertension. This study is based on data collected at the Department of Obstetrics at Rigshospitalet in Denmark and published in the Danish Journal of Obstetrics and Gynecology. Blood pressure monitoring in pregnancy is a cornerstone in the diagnosis and management of hypertensive disorders, and following a standard protocol is required to ensure the accuracy of the assessments, and especially repeating measurements usually decreases blood pressure, at least in non-pregnant populations. The aim of our study was to assess the adherence to guidelines recommended by international societies on measurement of blood pressure in obstetric clinical practice, and to determine if measurements strictly following guidelines differed from standard clinical measurements. We included 60 women admitted to the maternity ward for hypertension. The blood pressure was measured by hospital staff according to usual clinical practice and by study personnel according to international guidelines. We compared the two sets of blood pressures using paired sample t-test and the Mantel-Haenszel test. The main findings of our study were that none of the clinical measurements fulfilled all recommended guidelines, and that systolic blood pressure decreased by 7 millimeters of mercury when the measurement was performed by study personnel. The diastolic blood pressure decreased by 2 millimeters of mercury, and the risk of being categorized as hypertensive decreased by 22%. So the take-home message from our study is that we can actually decrease blood pressure by following the recommended guidelines. We can also reduce the risk of being categorized as hypertensive, decreasing misclassification, unwarranted medical treatment, and anxiety in the patients.